As was mentioned, I direct the Energy Studies and Buildings Lab, but additionally, I direct the Biology in the Built Environment Center and an institute called the Institute for Health in the Built Environment. Together, we're a group of designers and scientists from multiple institutions that partner with groups in industry in a program we call Build Health. And together, our goal is to look for the synergies between energy efficiency and healthy indoor environments. Today, I want to emphasize that a vision of resiliency that encompasses human health indoors and unleashes the power of integrated design is the key to unlocking deeper energy savings while also promoting health indoors. Why does resilience in buildings matter? Americans spend over 90% of our lives in buildings. After decades of increasing lifespans, now we see declines. We're spending more on healthcare than other industrialized countries, yet our quality of life and our life expectancy is decreasing. Evidence is mounting that indoor environments impact human health outcomes. You may have heard of sick building syndrome and thought we fixed that a couple decades ago. But maybe more recently, you've experienced headaches from background noise, from traffic, or a building fan whirring. And the WHO has connected those kind of impacts to cardiovascular and metabolic health implications. Or maybe you've had a child or a grandchild come home from daycare and with a rapidly transmissible virus that wreaked havoc in your home, or maybe you got sick, or a loved one you had got sick when they went to the hospital, the very place they were meant to go get healthy. So indeed, indoor environments impact human health. So how are we doing on energy efficiency? Certainly we've made tremendous progress in efficiency. Lighting and HVAC technologies, secondary glazing systems, smart windows, smart building infrastructure software, many of these innovations funded by the Department of Energy, implemented through GSA, and then supported with public utility investments. Recently, we worked with a group called the Northwest Energy Efficiency Alliance and Seattle City Light to pilot the first pay power purchase agreement for energy efficiency. It's typically used for rooftop solar. These efforts, though incredibly important, have only slowed the growth of energy consumption in the United States. I'll argue that we need more leverage. We spend $1 on energy, and for every dollar we spend on energy, we spend $100 on employees. We need to focus on people. We need to focus on improving the health and wellness of people in buildings, and we need to make sure that we pull increased energy efficiency along for the ride. So what is a resilient building? You might think of a resilient building as passive survivability, this idea that under a power outage, that people can have access to light and air and still occupy a building safely. But we need a grander vision that I'll call passive thrivability. This idea is that resilient buildings can improve the health of occupants, regenerate the health of the planet, produce more energy than is consumed, and support a healthy bottom line for the businesses that operate within them. It's a grand vision, but the good news is we have 2 or 3 decades of lessons that can be learned from our efforts in energy efficiency market transformation that can be brought to bear. We've learned that we need ingenuity and innovation, we need incentives and investments, we need policy and education to sustain that innovation. This can be complex or really quite simple. When we put people next to an operable window, they get an access to views of nature, they get abundant daylight, they get access to fresh air when they think they need it, and these have all been associated with increased health outcomes. Circadian entrainment, supporting healthy sleep-wake cycles, accelerated stress recovery, and reduced exposure to indoor toxicants. This elegant strategy also can save tremendous amounts of energy. This is passive thrivability. I encourage the committee to consider the following recommendations. I suggest we need to capitalize on the investments that we've made over decades in energy efficiency, document the persisting energy savings, establish reinvestment mechanisms, and research the associated non-energy benefits of health and comfort, such that we can drive these investment mechanisms for deeper energy savings and improved health. At the University of Oregon, we call this approach to this program BTUs for BTUs, or building tune-ups for reduced energy savings, BTUs. We're developing metrics for non-energy benefits, developing institutional performance verification strategies, and reinvestment plans. We're expanding this with a campus-wide building resilience initiative. In closing, I'd like to suggest that federal buildings have a well-established tradition of serving as agents of change in our built environment, and the lessons that we've learned in the last decades on energy efficiency can be applied to our new vision for resiliency. Thank you.
Dr. Russell?